Hello, this is Dr. Mir Nadeem. Today our lecture is environmental emergencies. I think this is first aid class, and environmental emergencies are usually the emergencies where if we take steps as soon as possible, we can save lives. At the end of the day, any health emergency which requires a health worker. In health worker, it can be a paramedical staff, it can be a dentist, it can be a medical staff, it can be a nursing staff, because we know actually about the first aid techniques. We know how to save a patient, irrespective of which field we actually practice. If we talk about the Western world, and in fact in our part of the world also, now we are very much conscious about providing first aid training to the general population or to the medical staff or healthcare workers. Why? Because what have been seen in the past, a lot of research, we have seen that if we give the health of if any health worker or even the general population give first aid to any patient who is in an emergency, that patient can be saved. So we can save the lives. Usually environmental emergencies, these are the conditions which are caused or worsened by the weather, or which in other words we can say which are caused or worsened by the environmental conditions. Anybody who has his or her mic on, please put your mics on mute so that we don't get disturbed while I am speaking. Okay. So the medical conditions that are caused or worsened by the weather, terrain, or the unique atmospheric conditions like high altitude or underwater, these are called environmental emergencies. If we talk about the weather, you can see in hot or cold weathers, you can see a lot of patients, they suffer from heat stroke, while especially in the summer season. Not in this part of the world, not in Ava, but yes, you can see these in Jeddah, you can see these conditions in Riyadh, you can see in Makkah and Medina, they can have heat strokes. Or you can see a lot of patients, they have frost bites or cold hypothermia because of the cold atmospheres usually seen in the higher atmospheric places, may be seen in Aba, very less likely. But yes, in Aba, you can see that maybe children or elderly, if they are ignored at the family, they can suffer from hypothermia or hyperthermia. High altitude sickness or underwater sickness, you are well versed with. A person who goes in the high altitude, he is not able to tolerate the high atmospheric pressure, and he can suffer from what we call as high altitude pulmonary edema. Maybe we will talk about them. And in underwater, you can see that the patients can suffer from drowning or near drowning. Environmental emergencies, they can occur because of heat or cold exposure, as I told you. They can be because of drowning or near drowning. Drowning means that patient gets completely into the water, like drowned into sea, as we see in the beaches. Or near drowning means that patient has drowned in the sea, but he has been saved by the what we call as people around there, but still he has a danger of being sick or getting killed. Or diving emergencies, usually seen in divers, lightning strikes, bites, and envenomatous conditions, maybe because of snakes, maybe because of scorpions, usually seen in the places where we go for the environmental outings, we go for the trekkings. So factors, very important is that the factors which affect the body temperature. Because see, if our body temperature has been affected, because our body has a very unique method of regulating our temperatures. For example, if in winters we feel cold, our body tries to shiver, and you can see because of the shivering, the body temperature increases. So there is a thermoregulation in our body to maintain that temperature. Or in summer times when there is a lot a lot of higher temperature, the body starts perspirating, or we have a what we call as a lot of perspiration, and that loses the temperature of the body to keep our body cooler. So these thermoregulations are there in practice while we don't have any underlying conditions. But these regulations may be affected maybe in the extremes of the age. Children, their thermoregulation is not well maintained, or elderly people, their thermoregulation is affected. Okay. So the conditions that affect the body is the physical conditions. Maybe by physical conditions we mean that patient having any comorbid conditions, or how is his physical build, is he obese, or is he lean, or age, younger or older people. Usually by younger age we mean the children, maybe around 10, 15 or less than that, kids. I don't think you people need to write your names for the sake of attendance. Those who have joined the class at the end of the lecture, I will take the picture of the participant area of the this. I will get the attendance. You don't need to mention your names in the chat box. Okay. Nutrition, hydration, pre-existing conditions like diabetes, cardiac abnormalities. These people are more prone to conditions caused by heat or cold emergencies. So, what are the methods by which the body can lose heat from our internal organs or from the skin to the environment? One is the conduction. Here the heat transfers from one body to another. Kindly please stop writing these messages. You don't need to write the messages in the chat box to know, to tell your attendance. Your attendance will be marked after I finish my lecture, and it will be, I will take the photograph of the participants which are being shown on my this. For example, shown in the picture, a person is sitting on a stone. You can see that he turns his body to convection when the two objects are in contact with each other. Then convection. Convection means that heat transfers through operation. Body cooling occurs through sweating. As I told you people, during the summer times, there is a lot of sweating, there is a lot of perspiration, and because of that, once you can see that it's basically a cooling mechanism by the body. That's why during the summer times, or when you have a lot of clothes, you sweat a lot. That is to lose the heat from the body. Lastly, the radiation heat loses directly into the environment. While, for example, if your heat or the body temperature decreases by direct loss of heat into the environment. And that's why usually if you see that once we have wore good amount of clothes, our body is warm, but once we remove the clothes, obviously there is a transfer of the heat or radiation of the heat, and person feels cold very fast. And last of the mechanisms that's very important is the respiration. If you see, if the respirations, they help in body heat loss, especially if patient is very like in higher temperatures. You will see that the breathing pattern changes, and a lot of heat is lost through the respiratory secretions. Okay, rate and amount of the heat loss is modified by increased heat production. moving to the sheltered area where heat loss is decreased, and wearing insulated clothes. Usually seen in cooler areas where the temperature is around minus 10 degrees centigrades or minus 40 degrees centigrades. You will see that people wearing insulated clothing. Their areas are sheltered, their heat, so that the heat loss is very less. Their homes are centrally heated, so that the heat loss is very much less, especially because once the temperature are in minus 20 to minus 30 degrees centigrade, you expect a lot of heat loss. Okay, so if the heat loss occurs in the body, there's a condition called hypothermia. Hypothermia is the medical condition where the temperature of the body is below 95 degrees Fahrenheit. Weather does not have to be below freezing for the hypothermia to occur. For example, if you see even some conditions like Hashimoto's, thyroid disease, or what we call as in hypothyroidism, people can have, especially the females, they can have hypothermia even if the temperature outside is not freezing. Usually seen in geriatric patients. By geriatric we mean older patients, elderly patients, or pediatric patients, or younger patients or kids. Some patients may have other illnesses or injuries, for example brain injuries. For example, if a patient has road traffic accident and he has a brain injury, his hypothalamus gets injured and the thermoregulation gets affected, and these patients can have severe hypothermia, or they can have severe hyperthermia depending upon the extent of the damage. So this is the hypothermia chart. You can see when does the at what temperature the exhaustion or unconscious occurs, or hypothermia is the core body temperature. By core body temperature we means the usually the best way to measure the core body temperature is we measure the esophageal temperature. Basically we put a endoscope into the esophagus and there we measure the core body temperature. That is the best way to measure the core body temperature. But the crude ways to measure the core body temperature are, you can put in the mouth, or oral temperature. You can see the perianal temperature. These are the other methods, more convenient. Whereas the best way is the esophageal or by endoscopic method. But esophageal or endoscopic method being an invasive procedure, we usually don't do it. So mild hypothermia is the condition where the core body temperature is between 90 to 95 degrees Fahrenheit. Usually in these patients you will see shivering. The patient will be shivering. Basically shivering is a protective mechanism, but the body tries to generate heat once a patient is shivering. It is a protective mechanism against hypothermia. Second, the patient's pulse will be fast, his respiration will be fast, he will be breathing very fast, so that more heat is generated. His pulse will be fast because again it is a protective mechanism. Patient's skin will be red, he will be pale, or cyanotic skin. By cyanotic skin we say that it's bluish colored skin, or it has a reduced hemoglobin in it. Moderate to severe hypothermia. The core body temperature is less than 90 degrees Fahrenheit. Again, if the patient is not treated on 90 to 95 degrees Fahrenheit, it worsens. It can go into moderate to severe hypothermia, where the signs get worsened. The patient's shivering stops. Why shivering stops? Because now the patient is exhausted. The body is not able to maintain the temperature. Body is not able to generate the heat, and because of the exhaustion, patient now is not shivering. His muscle activity stops or decreases, so he is not moving more now. He is just sitting calm on a bed. If he is in hospital, if he is admitted, he will be calm on a bed, or if he is outside, he will try to squeeze himself decrease the muscular activity so that more energy is conserved. There will be, now as the temperature gets more down, patient will have mood changes, he will be lethargic, his consciousness will be impaired, then his muscles and joints become stiff, he is not able to speak, and eventually all the muscle activities stop and patient can go into cardiac arrest. Severe hypothermia is core temperature below 80 degrees Fahrenheit. Again, the vital signs will be decreased. Patient will have bradycardia, heart will beat very slow. The respiration start getting absent or very slow. There will be cardiac abnormalities. The heart rhythms arrhythmias will be there. The pupillary reaction is very slow. And eventually patient dies of cardiorespiratory arrest. So, what are the ALS indicators in hypothermia? By ALS indicators, we mean, because see, we are studying a first aid course. The ALS indicators means that when we have to resuscitate this patient. When does this patient needs an advanced resuscitation? When the patient's level of consciousness decreases, we have to be very fast in knowing the condition and knowing that the patient is worsening. If the temperature falls below 95 degrees Fahrenheit, if the patient starts, the shivering stops, if there are significant comorbidities, patient has other illnesses like hypertension, diabetes, his age is more than 65 degrees, and if patient has a sudden cardiac arrest or patient's BP is on lower side, the patient's BP is less than 90 by 60, you have to, these are the indicators that you have to start the advanced life support in this patient. By advanced life support, we mean that if patient is in arrest, we have to give the CPR, we have to resuscitate the patient. If patient is in hypotension, you have to give fluids, you have to resuscitate, you have to admit the patient in high dependency unit. If patient's like he's in a respiratory arrest, you might have to intubate the patient and put him on ventilator. Okay, how do you take care of these patients? First of all, make sure, so basically if we talk about the patient care in these patients, there are basically two ways of care. First is if patient is in a peripheral area or the peripheral environment, and second is if patient is in the hospital. If he's in peripheral area or he's at home or he's in some what we call as nursing care area, he's not in a well-built hospitals. In peripheral areas, you have to make sure that you remove the patient from the cold environment. You protect further loss, heat loss. By protecting further heat loss, we have to make sure that, for example, if patient's clothes are wet, they maybe because of the rain, because of the snow, because of the water, you have to make sure that his clothes are changed to protect further heat loss. You have to make sure that you remove the patient from the cold environment. And if the patient is in hospital, make sure you give oxygen, make sure you give ventilatory assistance, make sure that you rewarm the patient, and make sure that you connect the patient to the monitors to monitor his vital signs, to monitor his temperature. Okay, there's a condition called frost nip or immersion foot. Basically, it is a chronic condition. We can say it may be a subacute condition or chronic condition that occurs because of the repeated exposure to the cold temperatures. Frost nip is basically freezing of the skin, not the deeper surface. So usually it is a milder form of a cold sickness. So what happens, the skin becomes very frozen. Usually it's not painful, but you will see that patient has a hard skin and he is aware of it, especially in the colder regions, the tropical regions where the temperature is winters sub-zero temperature. Immersion foot, also known as trench foot, it's usually caused by prolonged exposure of foot to the cold water. Then third, very severe condition, it's called frostbite. It's a serious local cold injury. Here the skin as well as muscle is damaged. I request the student who has put on his mic, please put off your mic. Thank you very much. So it's a serious local condition. Injury occurs to skin as well as to the muscle underneath, or sometimes if the patient's condition is not treated, patient can develop gangrene in his these fingers or toes, all the smaller and big toe, usually seen in young children and elderly who are usually mismanaged at home. They are not taken care of very well. They can also be seen in diabetics. They can also be seen in patients having immune mediated conditions like rheumatoid arthritis or SLE or other conditions. So if this condition is not treated, it can lead to gangrene. So cellular damage occurs, leading to permanent inflammation, tenderness, cold intolerance, and even gangrene, as I told you. But this condition is very painful. The patients are usually painful. Okay, how do you take care of it? Remove the patient from the cold environment, protect cold injured part from further injury, remove any constricting or wet clothing. You have to split the injury. Do not let patient walk on the affected extremity. You have to make sure that the patient takes a complete rest, and you have to make sure that you do not massage the injury to rewarm it, because if you massage the injury, there will be more injury to the skin, because the skin, the blood supply to the skin because of cold environment is decreased, and if you massage it, there will, to rewarm it, the injury will worsen. So please, whenever there is a frostbite at your home, do not massage to rewarm the patient. Then after the cold injuries, we go to the heat exposure. Heat exposure is basically when the environmental condition, the environmental temperature is more than higher than the body temperature. One. Second thing, maybe because of injury to the brain, the thermoregulation of the body is disbalanced, and patient can develop heat exposure. Normally the body temperature is around 98.6. It's basically a range of 98.4 to 98.8, and it varies from it is different in the morning and it's different in the evening, usually a bit higher in the evening. Normal body temperature is usually higher in the evening. It's almost 1 degree higher in the evening. So body attempts to maintain the core temperature. Despite what is outside, body tries to maintain this core temperature by cooling, by sweating, or dilation of the blood vessels. High temperature and humidity decrease the effectiveness of cooling mechanisms of the body. But yes, if the core temperature rises above 101 degree Fahrenheit, the severity of the heat damage increases. So who are at the risk, which are the patients who are at the risk at your home or in the hospital? Usually the newborns, usually the infants, usually the children and the elderly. And the patients who have comorbid conditions like heart disease, COPD, dehydration, and obesity. Patients with limited mobility, they also have this problem of getting heat-related injuries, and alcohol and drug use. The milder form of acute heat injury is the heat cramps, painful muscle spasms. Usually patient have painful muscle spasm, he feels fatigued, he is not able to do any work, he just wants to sleep, especially occurs in the summer season. The best thing is remove the patient from the heat, rest the cramping muscle, give lot of fluids, and transport to the hospital if cramps persist or worsen. After heat cramps, the another stage of heat injury is heat exhaustion. If patient's heat cramps are not getting better, or he is not given care, or the fluid is not given, he is not hydrated, patient worsens, he gets dizzy, there is fainting, weakness occurs, Patient's mouth is dry, his tongue is dry, there's increased thirst, the skin becomes clumsy. Usually the vital signs in heat exhaustion is usually normal, but you may see increased pulse rate because of increased temperature. Then the worst or severe form of the heat-related injury is heat stroke. Very common, usually seen in cities where the temperature is very high. It's more than 40, 45, as we see in Riyadh, we see in Jeddah, but not in parts of Aba or this peninsula, because here the temperature doesn't go more than 30. Patient is hot, he is flushed, but he's not sweating because the mechanisms have already been distorted by increased heat. There is change in behavior. Patient has loss of consciousness. He is not responsive. Now the pulse, which was earlier fast, it starts getting slow. There is drop of blood pressure. And if patient has not been managed, if patient is not been given fluid, if patient is not been resuscitated properly, patient can die within very less time. So what is the difference between heat stroke and exhaustion? Usually exhaustion is a milder form of disease and heat stroke is a severe form of disease. So it's very important in these patients to know clinically, because sometimes you are in a periphery while you are working, you do not have much avenues. You have to decide as a clinician or as a healthcare provider, is it really a heat stroke or it's just a heat exhaustion which can be managed by giving patient lots of fluids and decreasing the body temperature. Usually clinically, if you see in heat exhaustion, the skin will be moist, it will be clammy skin, and the temperature will be normal or subnormal. Whereas in heat stroke, the skin will be dry, the body temperature will be very high. In heat stroke also, the patient will have bradycardia, heart rate will be decreased, whereas in heat exhaustion, it will be tachycardia, heart rate will be increased. So again, what are the ALS indicators? Where you have to make sure that the patient gets a what we call as high dependency unit care. First, if patient is altered consciousness, he has loss of consciousness, he's not responding, patient's skin is dry, and in presence of elevated temperatures, there is sustained tachycardia, or patient is now going into bradycardia, heart rate is decreasing. If there is hypotension and there is postural changes in the blood pressure. By postural change, it means that you monitor the blood pressure while lying down and then you monitor the blood pressure while standing up. If there is a variation on the systolic blood pressure of more than 10 milligrams per this mmHg, it means that patient has postural changes. It's again an indication that patient needs high dependency care and he needs resuscitation. First of all, in patient's care, usually in heat stroke patients, they need admission. So that's why it's very important to differentiate between heat exhaustion and heat stroke, because heat stroke patients cannot be managed at home. They cannot be managed at peripheral centers. They usually need a tertiary care hospital or what we call as a community care hospital, where the patient you have to remove from the hot environment. This is the first thing you have to do in any of these patients. Then you may have to apply the cold packs or wet sheets or towels. You have to give a lot of oxygen. You have to give a lot of fluids. You have to loosen his or remove his clothing so that he loses the body temperature by what we call as method of convection or radiation. Then you have to make sure that you monitor the vitals and temperature of this patient. Another very important environmental emergency is drowning. And drowning nowadays has increased in Western as well as Asian part of the world, because a lot of the people who are very much interested in the what we call as adventures. People nowadays like to go on adventures, maybe to the beaches where they want to swim. they usually go to the meadows where you have a lot of collection of the water, and people want to swim. Usually people nowadays go to a lot of outing. That's why the drowning incidences have increased. Usually whenever somebody is submerged or immersed in a liquid, that results in respiratory impairment. Why? Because whenever a patient drowns in a liquid, while he is breathing, he breathes water as well, and which leads to respiratory impairment. Yes. I don't know. I keep on requesting you, students, please don't. Ali Mushabab, please put off your mic. Thank you very much. Okay. So annually around 4,500 persons die because of drowning. This data is not from the Saudi Arabian area, because we don't have any epidemiological data from Saudi Arabia, but this data is from the West. Around 4,500 people die annually. Associated factors, usually because of trauma, because whenever somebody drowns, he may have a trauma to his head and he dies, or secondary to hypothermia. Now there are two terms, drowning and near drowning. Okay, so by drowning we say patient has been completely submerged into the water. Nobody was able to save him. But near drowning, usually patients get submerged into the water for some time and he has been saved. Usually in drowning, death results because of suffocation after being completely submerged in the water. Whereas in near drowning, patients usually survive at least temporarily after the suffocation in water. Usually in near drowning, patients may die because of what we call as edema, laryngeal edema. Whereas in drowning, patients die of suffocation. So in drowning process, the first thing is whenever a patient drowns in a water, he has a panic and loss of control. Once he has panic and loss of control, the buoyancy decreases and he gets submerged deep into the water. And because of deeper submersion, he gets exhaustion and there's laryngeal spasms, or what we call as diverse reflex. Then inefficient breathing, and patient eventually die of cardiac or pulmonary arrest. Okay, if we divide drowning in, there are two types of drowning depending upon the pathology of or the amount of water patient has aspirated. It's called dry lung drowning or wet lung drowning. Dry lung are usually very less amount of cases. Here small amount of water has been aspirated and patient's laryngospasm occurs, airways close, and patient asphyxiates. Whereas in wet lung drowning, 85% of the cases, large amounts of water enters the lung and patients have fluid or electrolyte imbalances. Usually most of the wet lung drowning patients, their prognosis is not good. Okay, so what happens? Water moves from alveoli to bloodstream. So there is hemodilation causing cell rupture, potassium gets released, and hemoglobin causes renal failure. There is loss of surfactants. So basically, if we see the wet lung drowning, there are multiple mechanisms that leads patients to death. The first thing is that there is rupture of the cells. Okay, so drop in hemoglobin. There is release of potassium. Potassium is very notorious to cause arrhythmias, heart abnormalities. Then because of the cell rupture, hemoglobin releases from the cell and it causes renal failure, because hemoglobin is not good for the renal tissue. The third mechanism is there is loss of surfactants. Basically, surfactants are these are the material that cover the alveolar space so that they do not collapse. Once there is a lot of water in the lung, the surfactants is lost and the alveoli collapse and the oxygen carrying ability of the alveoli decreases. In wet lung drowning, or what we call a salt water drowning, the water moves from blood streams to the alveoli, but there is hemoconcentration, which results in shock and pulmonary edema. Why hemoconcentration? Because in wet lung drowning we usually see salt water. Salt water has higher osmolarity, which results in hemoconcentration rather than the dilution. So what are the ALS indicators in drowning? First, any underwater rescue, you need to send the patient to hospital, be it drowning or near drowning. Because sometimes patient says, after near drowning, patient says, no, I'm all right. But even if patient says I'm all right, he needs to be sent to hospital, because these patients sometimes have late laryngeal edema and they die of lack of oxygen. If patient has loss of consciousness or altered mental status, you need to send him to the hospital. If there is respiratory distress, there is hypotension, there is hypothermia, the patient has a lot of comorbidities, you have to send the patient to the hospital. But if patient has cardiac arrest, you need to start CPR there only. If he is around a beach, you need to start CPR. You cannot send the patient to the hospital until and unless you resuscitate him in the periphery. Again, patient care usually done by medics or healthcare workers. Very important, if you suspect spinal injury, make sure that you take C-spine precautions very much. You stabilize the spine, remove the patient from water, put the patient in left lateral position so that more water doesn't go into the lungs. Do suctioning, bivalve mechanism suctioning, where you take water from the lungs, monitor vitals. Usually these things are done in hospital. Follow resuscitation protocol if patient goes into the arrest. All immersion incidents get transferred to emergency department. As I told you, all the patients who are drowned or near drowned, even if they tell you that we are okay, they need to go to emergency department. Thank you very much.